Welcome everyone, and thank you for joining us today. My name is Chiara Hampton, and on behalf of myself and my co-authors, Dr. Chris Smith and Dr. Silke Hecht, I will be presenting a video tutorial on how to perform the percutaneous catheterization of the jugular vein via long line inserted in the caudal auricular vein of the pig. We find this technique most useful when a catheter is required for longer periods of time, but here are a few other indications for use. We can also use it for frequent serial blood draws, as this catheter allows for blood sampling at a reasonable rate. A few contraindications exist. This technique uses the anatomy of the vein system of the ear to reach a central vessel. Let's see how. The caudal auricular vein, located on the caudal aspect of the pinna, takes us to the maxillary vein, which merges with the linguofacial vein to form the external jugular vein, which then feeds into the cranial vena cava and ultimately the right atrium. The line placement will require the patient to tolerate this procedure. Therefore, heavy tranquilization, sedation, or general anesthesia are recommended to perform it, depending on the pig's temperament. This procedure can be performed in sternal recumbency or in lateral recumbency with the pinna of interest in a non-dependent position. Materials needed for this procedure are scrub solutions and sterile gauze, a rubber band or any tourniquet, mosquito clamp, sterile gloves, a sterile drape, sterile flush, super glue or surgical glue, suture, wrapping material, and the catheter of interest, which in this case is a Myla longline catheter 20 gauge by 45 centimeter. The authors prefer using a 1-inch 18 gauge catheter instead of a 1.5 inch that is included in the package. Prepare the caudal and dorsal aspect of the pinna following your practice's standard operating procedures. At our teaching hospital, we clip the hair from the pinna, then scrub with chlorhexidine and finishing with isopropyl alcohol. Apply the rubber band at the base of the ear, stretch it, and clamp a loop with the mosquito clamp to create engorgement of the venous circulation of the pinna. The caudal auricular veins should now be visible. Sterile prep is important, as this long line is an indwelling option and can carry the risk of infection. To decrease the risk of contaminating the long line, we recommend the use of a sterile drape. Using a sterile technique, remove the cap from the clamshell. The non-cap clamshell is placed on the blunt end of the catheter and clipped on. The catheter is then flushed and primed with sterile saline. Set this aside on the sterile tray. The clamshell can be kept connected or removed at this point. The 18-gauge catheter is placed in the vein of interest. Our recommendation is to approach a vein that has a straight trajectory to avoid kinks and difficulty in feeding the long line. Insert the long line with the black finish tip first to the desired length. In general, feeding 15 to 20 centimeters should be sufficient to place the tip of the long line in a central vessel that allows also for blood sampling in a 30 to 40 kilogram pig. Feeding approximately 30 to 40 centimeters of the line in pigs over 70 kilograms should guarantee placement of the tip of the line in the external jugular vein. The catheter is removed and the clamshell is clamped to the blunt end of the long line one more time. Correct placement is generally confirmed by successful aspiration of blood from the long line. Certainly, radiographs or fluoroscopy can confirm the placement of the tip of the line, but we do not consider this to be a crucial step to the success of this technique. Secure the catheter in place by applying the suture wing and wing cover. We like to apply super glue to the bottom of the suture wing to affix it to the skin. Alternatively, adhesive dressing can be used to stabilize the catheter to the skin. The catheter is then wrapped with the bandaging material of choice. Make sure the shaft of the long line is never exposed out of the bandage, as this can form a loop that can get stuck on objects or rough surfaces. The pig can also damage the shaft by scratching its ear on surfaces or with their hind limbs. The clamshell connector can be connected to a luer lock extension set to facilitate flushing in pigs that are head shy. This extension set can then be taped to the hair of their dorsum for ease of access. The orange dot in the CT images show the pathway of the 45 cm long line fully inserted in the caudal auricular vein and reaching the external jugular vein in a 69 kg pig. These authors have used this technique in pigs of different sizes, with longevity of the long line reaching upwards of 9 days with appropriate maintenance. The authors have found clotting to be the most common complication, but here are a few others. Of particular importance is avoiding the use of scissors around the bandage of this line to avoid accidental migration into your patient. Thank you for watching this video, and we hope that this technique can help you and your patient care in the future.